Hi, everybody. My name is Jaco, my colleague here, Andronica. We are from Pila Health. Thank you for the opportunity. We would like to, we are very excited to participate in Africa Health Week. Andronica, I think I'm going to start with just giving a quick background of Pila Health. It's a young startup. And we look at health workers who provide care services to their communities. Now, our vision is to provide a convenient and affordable access to health workers in the community. And we focus on improving health well-being and encourage proactive, healthy living. Now, our mission is to transform the community healthcare industry by reducing the cost and by improving the quality of the care services offered by autonomous groups. Now, let me go into more detail on that. I want to first bring 4 things that I think most of us can agree on related to healthcare. The first is that every person wants control over their own lives and over their health. The second is that most people want to maintain or improve the quality of their life. Most people want to respectful integration and comfortable relationship with their healthcare providers, and most people want accessible, convenient, and affordable healthcare services. Now, if we can all agree on that, then we've asked ourselves, how can we improve the medical care industry? Because we believe the problem is that care became a product, and the patients became clients. This is what needs to be addressed. We believe the solution is, number 1, reduce the cost of medical care by removing management levels and reducing administration fees. And the second is to improve the quality of healthcare workers by healthcare providers that are passionate about caring and looking after sick people from their community. Now, as I said just now, we believe that autonomous groups who give care in their communities, that for us is the solution. And that is what I would like to go into more detail with this panel and to share with you. Now, if you look in South Africa, the franchise model, it's been very successful. South Africa is on the forefront in Africa. And looking at the franchise model, but also we got our inspiration from a company which is called Buurtzorg. Now, this was founded by a gentleman, he's a nurse himself, Jos de Blok, in 2006. Now, this Dutch home care organization has attracted international attention for its innovative use of independent nurse teams in delivering low-cost care. Now, the company employed 10,000 nurses and 4,500 home help workers in 2018, and the concept is now being adopted in 14 countries, including Sweden, Japan, UK, and in the United States. Now, this model of community nursing is widely cited as a promising approach to improving the delivery of integrated nursing and social care in communities. And the model is characterized by high level of patient and staff satisfaction. Well, in short, it provides effective, high-quality care at a lower cost. And that is exactly what Pila Health strive to deliver. Now, we believe the success of this model are changing the healthcare industry. But Africa is still lacking behind. So Pila Health strive to bring us closer to these ideals. Now, before I go into examples, I would like to first move over to my colleague, Andronica.
Thank you, Jaco. Hi, everyone. We are very honored to be here. As Jaco has said, we are a startup. Research has shown that healthcare, there are gaps in the healthcare, and people want better healthcare service. And one thing that comes, into to our mind is, how do you provide better service in healthcare without your staff members having soft skills? And which is something that is lacking in a lot of healthcare centers or institutions. It's something that, it doesn't really resonate when people think about nurses or doctors training. But it's very, very imperative that we address that. And that's where Pillar Health also contributes at. And if you look at the demographics of most African countries, culture is very, very important. And we have to make sure that the environment that our health workers work in, it's conducive, and it makes a patient to be comfortable with what they get from the healthcare workers, being in terms of communication, being with the healthcare worker, being able to listen and understand the backgrounds, the culture of our patients. And that's where we are so, you know, concentrating on community-based workers, as my colleague Jaco has said. And we see the model that it will work, because the community workers are with the community, the community workers are within the communities, and they understand the culture around the communities. They understand the daily burdens or any influence that might make the patient's life easier, and also being able to communicate with the family and the client and make them comfortable, and that in return makes the customer have better healthcare service. And this is part of where the health sector is going, in terms of, when you look at the model that Jaco has said, it's all about task shifting, where you use innovative ways of addressing the skills within the healthcare center and improving on them. This can also um, help with improving unemployment rate, and getting it down, because you can have young people getting into healthcare without going to study for a long time. There are a lot of people who are passionate about healthcare, but they don't know where to start. And our intention as Pillar Health is to take them and pair them with very skilled healthcare workers that are working for us, and getting those skills learned by the trainees that are coming in. And this is very, very, very interesting for us, because we think that we've got a winning solution here. I will give Jaco to give some examples.
Yeah, well, Andronica, I think what excites us so is to be part of this Africa Health Week, is for minds to get together and to talk about health. Health has become a very major issue. Since the COVID-19 pandemic, health is something that we constantly think of. And getting these minds together will find a way how to improve the care, the health of and especially in our continent, in Africa. Now, we believe if a person comes from a specific community, that person has got a special feeling for the people in that community. That person would know family, or know that person, the healthcare worker would know the patient personally, or know their families, and the well-being of that person would be very important. So we believe a relationship between a healthcare worker and a patient is when the healthcare worker wakes up in the morning, send a WhatsApp and say, how do you feel today? What time shall I come around and wash your back? Now, these are things which people are willing to provide in their community. And we are moving towards an era where people will be looking after each other in that community. I'm very excited. I think there's a bright future ahead of us.
Uh, I agree with you, Jaco. And I mean, with the shortage of the skills that we have in healthcare, I think within communities, I mean, this can work. It's a working model because they manage themselves, they administer themselves, they are treated like a franchise. They get best training from the people within the community. They understand each other, they understand the environment, and then this is exciting stuff. And then I think pillar health will make a difference. And going further, I mean, we're looking forward to partnering with our African brothers and sisters who are passionate about the healthcare industry to to join us, and let's make healthcare be accessible in in Africa as a whole, and make it a pleasurable feeling when you go to see a doctor or a nurse and you feel that what, somebody cares. And this is where we are, and we are just saying, let's combine the knowledge that we have, technology, great minds within the medical industry. We are just, and Pillar Health is saying, um, yes, we understand that we need the skills in terms of medical skills, but let's give the opportunity to the young and coming youth that around the world, around the continent, to be part of contributing to the community in terms of health. And this can be a winning formula.
Yes, I agree. And things has changed. The health industry need to change. We have now the information is on the internet. We have connect various groups with each other and provide them with the knowledge. The knowledge is out there to provide healthcare, but also as you said, the technology, where we're now in a situation where a nurse can open a laptop and facilitate a consultation with a doctor, which can only take a few minutes of the doctor's time and does not require from that patient to go to the doctor's office. So many things changed, I think, and that's what is exciting, is that the health industry will also be changing. Africa has been very innovative. We have the largest mobile uptake in the world, and we have the opportunity here to go in new fields of providing healthcare.
I agree with you, Jaco, and I'm excited, to be part of this event. It's for me, it's it's something that needs to happen not only once a year, but maybe quarterly. We need this kind of of events so that we can meet up and discuss healthcare. It's one of the critical things that needs to change in the continent. We have to learn from countries like India, what they have done, also in terms of health. And we have very, very skilled and very, very professional, uh, skilled people who can, partner with us who are, very passionate about technology as well, and change the healthcare industry to be a better solution for the whole continent.
And make everybody healthier.
Exactly. I mean, we talk about proactive health management, which is something that also needs to be, taken up, and especially when you look at rural communities and disadvantaged areas, and which is something that we are very passionate about. Know your health, know your status, be proactive when it comes to your health, and don't wait for for you to get sick as a patient and have to go to the doctor. And this is something that we have seen that it works. And we provide these services as well as Pillar Health, and it works in the communities. It lessens the burdens of long queues in the hospitals, and also we let the doctors, uh, concentrate on things that they can, make better in terms of speciality, and let primary healthcare, to the lower level healthcare workers, and that's what we are saying as Pillar.
Okay,
Okay.
I think that sums it up. Thank you for inviting us.
And here they are, Andronica and Jaco join us. Welcome to both of you. Thanks for joining us on Africa Health Week, and thanks for your presentation.
Thank you, Dave.
Thank you for inviting us.
And you spoke there passionately about the idea of Africa Health Week and spreading news and learning and bringing people together. And we're grateful for those comments. And you've come up with this model. Congratulations on the startup, by the way. It's always good to see people stepping out of their comfort zone and starting up these companies. You talk there a little bit about reducing costs by reducing admin, reducing management, and putting that money into your community nursing team. Is there a danger that those community nurses aren't seen with the same value? I mean, are they being paid, for example, at a good salary scale? They're not just a cheap option, are they?
No, absolutely not. We believe they should be well compensated, but providing it in this way reduces the expenses. If they need, for example, the consultation from a doctor, they log on to on a laptop, can log on to a doctor and get the professional assistance that they need.
And Andronica, if you've got a community nursing team, and you both talked about how that's almost a more user-friendly service, knowing that somebody's round the corner rather than several miles away, knowing that maybe your daughter grew up with their son, and all of those interactions, because people are quite often fearful, aren't they, when it comes to healthcare. So nurturing that kind of spirit is important to the value of a community nursing team, isn't it?
It is very important. And if you look at how disadvantaged communities are in terms of the demographics, it gives you comfort to talk to somebody who knows what you're going through, what you're experiencing, and also it in terms of the language barrier as well, it helps, because we find that language as well, when people go to the clinics or the hospitals, there's a language barrier as well that gets in the way of explaining what the problems are. So if they're talking to somebody who is in the community, who understand the culture, who understand the daily struggles of everyone in the community, and also it's just a call away, and somebody is there within few minutes. Within South Africa, there is a high volume of people who go to the clinics. People will wake up at 4 a.m. and just to line up to see a doctor. So what we are saying is, if we can provide primary health care, in this way, it lessens the influx of the clinics, and also people now they start caring about their health, because we also have partnered with one of the doctors who is very passionate about making healthcare reasonable, and there's an app that we use as well. So we've got tools. So whatever is at the clinic, when it comes to primary health care, we've got the tools that our nurses, they can take a backpack and go to the local community, and they've got everything, and the people can get if it's a chronic disease like diabetes or high blood pressure, it can be monitored on regular basis. They don't need to be at the clinic on regular basis. So that's what we are saying. Let's make it simple.
And yes, it seems like you're achieving that. Sorry, Jaco, you were going to say.
Yes, I wanted to add about this testing kit, the rucksack. Now, it's a kit, and we can do. Our team can do 27 tests from a bag which a person carries on his back. So it became very mobile to be able to do these important tests. And if you can do a test before you get to the clinic, you save some valuable time of the clinic personnel, already. But also these tests can also you can evaluate the progress. You can identify problems earlier. So part of the community nursing project is also the ability to do these tests regularly at a very low cost.
Yeah, it's a great idea, and it makes sense. I'm shocked that it seems obvious, doesn't it, that we should be doing this, and well done to you for making it happen. When you talk about community, do you have a ratio of one nurse per 10 families or 100 people? How does that work?
Basically, it's one nurse per 50 families around the area, and we expand as we see the need. We just started last year as per the pandemic started, and we saw the need as Pilar that we need to be on the grounds. And if you look at, we concentrated mostly on elders, because by now they couldn't go to to the clinics, and they were in danger of of COVID. So for us, it's convenience, and 51 nurses for 50, and also they work as a team. So it's a group of nurses that they support each other, and they all have their strengths in the team. So there's one who's very, very well with, let's say, diabetes, who knows diabetes very well and how to manage it, and there's one who can help with high blood pressure. So they support each other. And the nice thing about it is they can back each other up. When the other one is not available, the other one can go to the community. So it's a community based team.
And I would like to add that it's not the amount of families, but the need. So this autonomous group, the franchise, if you call it so, can decide if they need more, they can get more people in their team, or they can, in a community, another team can start. So it depends on what kind of requests do you get from that community.
Mm.
That flexibility is important, isn't it? Because my next question would have been around how you priority. So if 30 of 50 families all fall sick at the same time, or there's a tragedy in an area, then you how do you prioritize the most important? But you're saying that you can mobilize very quickly to attack that need.
Yes.
Add more people to your team, or bring another team in.
Because there's each and every community has its own team. So if the other team is not busy, they can just help the other team. And also what we are looking at is empowering the youth and letting them learn from, the professionals, already, all the nurses that they've already been in the profession. And this will also help us to, lower the number of unemployment in the country, which is a big problem currently.
Yeah, I think that idea of almost an apprenticeship where you learn from others, and maybe as well you find what you really enjoy. So if you're traveling around with somebody whose specialism is diabetes, you may think, yeah, that's what I really want to do, because as you say, young people often don't know, but they'll perhaps pick up on a specialism whilst they're doing more general work. Would that be right?
That's true. That's true. we are trying to encourage the youth as well to look at different areas of health. I mean, primary health care is very, very important. And if you look at the ratios of a number of patients per doctor, I think in terms of, I mean, what we are doing also with the youth is task shifting, whereby you say those tasks that are done by the professional nurses that can be moved to somebody else who doesn't have much knowledge, but who has been trained with the help of technology. Like we say, we've got an app and the kit, and they can go and, test a person for high blood pressure and log it onto the system, and the system does the algorithm at the back, and then they get the results. I mean, it's what we are aiming for.
Just a little thought of mine. If these people are in their community and they happen to be, I don't know, travelling to see a neighbour or going somewhere within the community, and they bump into one of these people, is there a danger that they say, "Oh, hi, while I've got you, I've got this pain in my knee," and that person might say, "Well, I'm actually not on duty at the moment." How would you handle that?
It's a community effort. I don't know if you know about Ubuntu. So in Africa, there is Ubuntu, and one of the speakers yesterday touched on Ubuntu. So with us, it's all about, I understand, they understand, and then they will make an appointment with them. We accommodate. As Africans, we are open to, those kind of situations. So
Brilliant.
Our nurses are also, because they are part of the community, they know them. It's like a family. So they, they do take up those kind of questions, but they do like help at the end. It's not like you have to pay, or they can help wherever they can. It's all about community.
It sounds a perfect model in that respect, very human centered. And who monitors the standards? How do you do that especially in remote communities?
I'll let
Jaco. Yeah, at this stage we are still fairly small, so it is something that we as we are scaling, we'll definitely more look at the standards. But I think the equipment we use are fairly standard. So it's a test, a hardware which conducts a test and give a result. Those kind of things are standard with the equipment and the app which gives the result. In terms of the care, it is a community who works together, so they look at each other's standards. But that's something that we look in the future, how we are going to create a team who goes to these different teams, provide them with the necessary training, and look at the quality of care, see how we can improve on that.
And how are you looking to strengthen healthcare delivery in underprivileged areas? Presumably the same model works wherever you are.
I think for us, the aim is for us to have more strength is to partner up with the healthcare institutions, the public healthcare institutions, and we are here to say we are here, we can help. It doesn't help to just look at the government and say, you have to provide. We have to do something from the ground. And if we can get the backing from the government to understand where we are and to alleviate the, all the burdens that they have with technology, with innovation, I think we can reach those trends.
I think the way you've joined technology and community and involving young people is very important, and that sort of triangle of care seems to be very important.
It is very, because it takes somebody who has been at the ground level, who can see the struggles, who can understand what people are going through, to see what is needed. The government by itself it can't, because they're not everywhere. So we are saying we have the ground workers on the ground. Give us an opportunity to help you, and with that we can. I think it can be. This is for us. It's a winning formula for disadvantaged areas and rural areas as well, because there is a lack of healthcare facilities all around, and this can be something that can be looked at in terms of evaluating, even having physical locations, because we are mobile. You don't need to have a physical location.
I think what you're doing is incredible. Anything that, as you say, reduces costs, increase accessibility, means that people don't have to travel. Certainly people don't want to get up early and stand in a line and then possibly still not get seen. So what you're doing, mobilising the community to care for itself, it's a great model. And I want to wish you both every success, especially as a new startup. Well done to both of you. It'd be great to hear from you in the future and see how it's going.
Thank you very much.
Thank you for inviting us.
Thanks for joining us. That's Jaco and Andronica. Brilliant presentation. So much innovation going on. So many ideas and knowledge that is impacting the health and well-being of people all across Africa and being shared now, of course, through this platform worldwide. So we've got one more presentation coming up. We're going to take a short break of around about 10 minutes and we'll be back for our final presentation from Saul Cornick.